Thought it was Sonia. How are you,
Oh,
Diana?
I apologize. Yeah. Okay. It's yeah. I'm good. Thank you. And you?
Doing well, thank you, thank you. Um, we'll make this quick. I'm pretty sure you got some other things to go. So just before we get started, how much time do we have? So we know what we can cover
We can
on the.
do the 15 minutes. It works just fine.
Perfect. All right.
Okay, so thank you for taking the time to get on. I'm going to go ahead and share my screen. While I'm doing this, if I can just kind of ask a few questions.
Absolutely.
The practice, you guys are a primary care, correct?
Yes.
Okay, and your payer mix, is it mostly commercial, Medicare, Medicaid, kind of a hybrid?
It's yeah. It's a hybrid.
Okay, so I'm not sure if you had a chance to look at the information sent. Are you the practice administrator or a
Yes.
physician? Yeah. Okay. So what our program is really going to do is we can completely integrate with the EMR if necessary, but we're going to virtualize the practice. So we have disease-specific care plans that are built around standard protocols and guidelines. And so what we do is basically virtualize the clinic through utilizing telehealth, remote patient monitoring, and chronic care management. Are you guys currently utilizing any of these technologies, or have you in the past?
For no, I don't think so.
Okay, and what EMR are you guys currently using?
Athena.
Athena. Okay, very good. So we're almost about to do complete a full Athena integration.
Okay.
Yeah. So what at the end of the day, what our mission is to improve access to care for the patients, improve clinical outcomes, and assist the practice in operating more efficiently by leveraging these different technologies while improving clinical outcomes and creating entirely new revenue streams. So there's lots of different CPT codes through commercial insurance, through Medicare and Medicaid that cover our services. And so the government passed some new legislation, and they've incentivized doctors by passing this legislation to use this technology to, at the end of the day, prevent patients from ending up in the hospital. So through these new laws, any patient with one or more chronic disease qualifies for this program. And through our continuum of care plan and the CPT codes that we bill on, or that we're able to bill on the doctor's behalf, this will generate about $200 per patient per month. So it's a very lucrative business model. We facilitate all of the management of the technology, of the professional services. So all the clinical call center services, the patient consents, the onboarding, the patient engagement, even the monitoring of the patients. We have a call center in McAllen where we manage all that. And then we also manage the staffing, and how we do that. The reimbursement guidelines is basically the patient has to track 16 days of vital biometric communications, and they have to spend 20 minutes per patient per month. So think if you have 1,000 patients, that's 20,000 minutes. That's quite a bit of hours. And so who would do that, right? And so we saw that 333 hours a month, right? And so we saw that coming, and so we created on practicums and curriculums, and we've aligned a lot of this with the local technical colleges, South Texas College, Texas State Technical College, and we have created a health informatics and IT training program that the state recently awarded us a grant on. So at the end of the day, we want to help facilitate and improve operational efficiencies, better manage the patients, and create new revenue. Do you have a clinical background, or do you have more of a practice administration background?
More of a practice administration background.
Okay, very good. So when we set this up, this is just, I'm going to kind of touch very high level on the clinical side, and then show you more on the technical side. Can you still see my screen?
Yes.
So this is how we build the care plans that are already all pre-configured and built around standard protocols and guidelines. But before the telehealth and remote patient monitoring and chronic care management, we're an education, communications, and empowerment platform for the patients. And so we do a lot of different things to educate them on these new services on your behalf. And then this is how we set up the clinical part. And so the doctors basically approve of this stuff. And so this one's for diabetes. And so the doctor in this account wants to check glucose, weight, activity, steps. And if the glucose is below 126, they want an alert to go off. If it's above 200, they want an alert to go off. The doctor wants to remind the patient daily to take their or to check their glucose and take their insulin. And he wants them to get every 3 months a hemoglobin and A1C test. This is a standard diabetes protocol. He also wants preventative screening reminders for eye, foot, and urine test protein once a year, and fecal blood for people, blood stool for people that are over 50. And so this is just a protocol. We align it with quarterly goals for the patients that align with value-based programs. No hospital admissions, improved vital biometric data, patient engagement, patient compliance, and improved access to care. We then align it with all the value-based programs like Bundled Care Payments Initiative, MIPS, MACRA, Quadruple AIM. And so we all really manage the continuum of care of the patients. The doctors really don't do too much on this. It's more of a medical assistant, pharmacy tech, health informatics and IT associates. So it's a lower level kind of employee, but then we're able to triage the patients up to the mid-levels or the doctors as needed based on the protocols. Do you have any questions so far on how we kind of configure the care plans?
Oh, she said no. Hold on. Trying to get it on mute. Hold on 1 second. How do I unmute this?
What unmute? You're unmuted.
No questions so far. So I can see her chat now. Here we go.
Okay.
So we're basically almost like a mini EMR as well. Again, we're doing a full integration with Athena, but to start so that it prevents a lot of upfront costs, we do a stage 1. And so we can configure these fields and exactly, gather the information from the EMR and pull it directly in. So it makes it easy for the care coordination on our side and for our health navigators and care managers to be able to facilitate the patients and manage them accordingly. When it comes to managing the population of the patients, this is our dashboard where we can triage and identify the patients by base of need. Move this down here. And so we can look at all of the patients on the platform. We can look at their activity from them signing into the app for the last 7 days, 28 days. And then based on the care plan, which I'll show you in a second, we can see whether the patient is checking their vitals or not checking their vitals. If they're doing their medication, hitting the medication reminder check, or if they're not. We can check activity. So there's lots of different actionable things that we can track to make that information valuable to the caregivers so that we can take proactive preventative measures instead of reactive treatment-based measures. Does that make sense? You're on mute, so I'll keep going. When you look at managing the patients and their adherence, based on the rules engines on the care plans, which I'll show you, we can tell the doctor or see who's being adherent and who's being compliant or not. And so when you think of looking at how we develop these, it's all by disease. So for hypertension, you have blood pressure. For diabetes, you have the glucose. For temperature, you have temperature, right? For people with asthma or COVID or anything, it's respiration or pulse ox. So we can really track all of these different things based on the care plan. and we set all this up for you guys. When you look at the rules and engagement of the actual care plan, sorry, the protocol. So this is how we were able to really automate a lot of the communication and stay engaged with the patients based on their activity, and even provide them with a lot of good reinforcement. Like if they're doing things where we gamify, we can give them like loyalty and rewards components to where it makes them want to, you know, live better, live healthier, things like that. And so this is just, it's all on a drag and drop configuration, but whether they have a result that's low or high, or it's a certain percentage off, or they don't do it by a certain time of the day, we get an alert. It goes into the dashboard, and the people doing the monitoring then engage with the patient. If we send them a survey, because we have a survey and symptom engine checker, and they don't answer the survey, that would create a yellow alert. Where if they answer the survey and it's just say it's you know, for a mental health person, have you thought of hurting yourself within the past 24 hours? And if they say yes, that's going to be a red alert. And so we can really identify this information and make it possible to make actionable decisions. So you can do it by measurement, by events, or by the daily scheduled time, by a deviation of a certain measurement. So I don't know if you have any questions there, but it's more on the clinical side. I'm going to dive into the billing and the reimbursements and stuff like that. Unless you have any questions, I'll kind of stop for a second or look at the chat. No questions so far. So when you look at how we bill the insurance, there's several different CPT codes. And before I go into that, let me show you. How are you on time, Kurt?
I would assume we got about 8 or 9 minutes.
Okay, so this is our value-based contract. That's where insurance companies, I mean, hospital systems, everybody's going towards value-based. And so we look at this more of a partnership. We want to invest in your practice. We invest a lot of technology, IT infrastructure, personnel, and time. And so we look at this as a true partnership. From here, we have the doctor identify specific target diseases, and we do 250 on this stage 1. And then this is where the value-based terms come in. So whether we predetermine the objectives first off, and so we improve the cost of care, create a new revenue opportunity, improve time to contact patients, patient safety, patient satisfaction, patient adherence, provider and staff experience, staff utilization, improved continuity of care, document activities of continuity of care for audits and things of that reason. And we predetermine what the measurement standard is and what a success or what a failure is. From there, we predetermine the program phases.
Do you want to show your screen?
I thought I was, but let me reshare it. I think because I clicked out. So thank you for reminding me on that.
We're stuck
You
on
see
the
it?
vital pay. There you
See
go.
it now?
Yep.
Okay, so let me go back to here. So we predetermine the target diseases. We go through the value-based terms, improve cost of care, revenue, opportunity, improve patient contact, time to contact patients, patient safety, satisfaction, provider staff experience, staff utilization, improve continuity of care. And we predetermine our measurement standard and what a success and what a failure is. It's where the value-based terms really come in. And then we identify a training and setup. We put together an ROI and sustainability model, all of these different program phases, and we predetermine our responsibilities and what the healthcare organization's responsibilities are. The daily monitoring, the weekly review, monthly review. And then from there, we basically invest quite a bit of money in the practice. We charge a initial setup fee of $5,000, and then there's a $5,000 within 30 days. We can push that off and take the startup costs out of the revenue, and that's something we can talk about with you, the doctor. But from there, we execute, we onboard the patients on schedule, and we make sure that they meet the reimbursement guidelines in order to bill accordingly. And if we do everything within the first 90 days that we agree to in the value-based terms, it then moves into a long-term contract, and we try to enroll every patient that qualifies that's in the EMR. So that way, within the practice, the patients win, the doctor wins, and obviously we have a stake in that. Other than that, that's pretty much the value-based terms. I have other documentation. We do facilitate all of the revenue cycle management and insurance verification and authorization as well. And how we do that, we have a revenue cycle management technology where we integrate with the top 5 clearinghouses, and we can bill on the doctor's NPI number, and the money goes into your bank account. We ACH out our piece per patient based on the contract terms, and it really becomes a reoccurring kind of passive residual income for the practice. Other than that, I know we're limited on time, so I'll kind of just open up for some questions if we have the opportunity.
Let me see.
Okay, no, I don't have any questions. Can you just send me all of the information? Do you guys have like a slideshow that I can show Dr. Sanchez?
Yes, and we recorded this meeting,
Okay,
so we can also
perfect.
send an audio file as well,
Yes,
attached with the documentation that we went
yes,
through.
yes.
Yeah, and we would probably want to, and we didn't really dive too deep into the platform that shows basically the reporting that we were able to pull all of this information that when you're on the platform, there's basically an audit trail that's set for the time spent monitoring the patients. Again, just like Kyle was explaining, we've tried and make this a complete hands-off approach. So there's not any software or hardware that the practice has to download or that we got to teach anybody, any of the employees. It's really us utilizing, like Kyle said, our call center and our software and technology to really reduce a lot of the tedious tasks that you guys deal with on a day-to-day basis, which and then increases patient care and then drives more revenue to the practice. So,
Perfect.
yeah.
Okay.
So we'll go ahead and send that over. And then if a doctor has any questions, he has my cell phone number. He'll go ahead and follow, and I'll follow up with him in a couple of days as well.
Perfect. Thank you so much.
Thank
Thank
you,
you,
Diana.
Sonia. Have a great day.
Thank you. Bye-bye.
Bye-bye.